Tyler Coburn, our NDP candidate in Dartmouth East, and I are here this afternoon to talk about a subject that Tyler and I and all of our candidates find ourselves engaged in many conversations on the doorsteps about. That is people's difficulty with the doctor shortage. People not having a family doctor, or probably I should say more precisely, people not being able to access primary care. So maybe Tyler, I'll just ask you to say a little bit about how the whole doctor shortage business affects you personally.
Yeah. I'm really lucky because I had a really great family doctor for years, and when I moved to Halifax I got one because my mother had the same doctor, but she ended up closing her practice in 2019, and since that time it's been hard to access primary care. I have a lot of complex health conditions, and essentially it makes me have to be my own advocate. And so when I'm receiving care, whether it's at the hospital or taking care of my own health in ways that on my own, I have to be the person that holds it all. And so it has been challenging, and on the doorstep I'd say it's probably the number one issue. Most people are talking about having a lack of primary care.
Yeah. And so where do you go when you need to get primary care, and what's that like?
I think for me and for many others who don't have family doctors, my mother and my partner included, we just don't go. You wait a really long time until something really bad happens, and you don't want to wait at the walk-in clinic. If you're experiencing a crisis, you end up going to the emergency room. I've been really lucky that I haven't had to go in the last few years, but I have had to go, and I'm really grateful that we have emergency care. And to sit there in pain or in discomfort for 6 to 10 hours to receive care that could have been mitigated a long time ago with a primary care, physician or something like that, it just seems really ridiculous, and hard.
Yeah. And this is something that you can identify from the conversations you're having on the doorstep as top of mind for a lot of people.
Yeah, it's definitely in the top 3 issues. A lot of people in this area, it's one of the older populations in the province, and lots of people are experiencing that their primary care physician is retiring. And so they have nowhere to go.
Yeah, totally.
And then they're often on a wait list for a very long time. Myself, I got on the wait list pretty quickly after my family doctor left, and then I got a family doctor, and that family doctor, it was right before COVID hit, instantly moved to Sackville. And so I no longer had someone that could see me.
Yes, well, exactly, and I know that all of our candidates are having a lot of parallel conversations, and we know that there is a step that can be taken to address this very question of the lack of primary care that people are experiencing and people are so concerned about, and that is to integrate the position of physician assistants into the model of the providing of primary care in Nova Scotia, so that we can extend the range of the physicians who we have to cover the scope of the population who medically we have to serve. And so to this end, I want to register the commitment that an NDP government will immediately integrate 7 physician assistants into the model of care in Nova Scotia and deploy them both to emergency rooms and to the provision of primary care according to where the need is greatest.